Namaskar, I'm Preeti Prakash. Today, let's talk on health. We all know the adage health is wealth, and they're not just words. Life has changed drastically since our fathers and forefathers, and so has lifestyle and health matters too. The good thing is that we started talking about them more. So, not just about physical wellness, but even mental and emotional well being, which was not so in the earlier times. But what I want to talk today is about some problems on hearing the very name of which sends chills down the spine, those which are considered fatal and so dreaded. Cancer. How does one know whether he or she is developing cancer in the body? What stage is it? Where do they go for advice? How much does the treatment cost? What's in for the patient and the family? Are all questions that take a very heavy mental and psychological toll. More than that, what totally shakes the patient is whether he or she will survive or not. To talk about this, I have with me two cancer survivors, Ram Thavle, an army veteran, and Rajalakshmi, a Delhi-based senior journalist. Colonel Thavle has undergone a lymphoma, if I'm pronouncing it right, treatment, and came out of it successful. And Rajalakshmi has survived breast cancer and bounced back. She continued her writing assignments from home while undergoing treatment and also suffered COVID while at it. Not a small thing. Both Rajalakshmi and Colonel Thavle are examples of courage, hope, and positivity. My panel cannot be complete without our cancer specialist, a renowned name in oncology since 30 years. Dr. Ranga Rao is one of the best medical oncologists in Gurgaon. He is presently chairman Paras Cancer Center. He has earlier been with Max, Super Speciality Hospital, BLK, Rajiv Gandhi Cancer Institute, and RR Hospital. He's an expert in management of all types of cancers and deals with chemotherapy, hormonal therapy, targeted therapy, and the recently introduced immunotherapy. The range of solid tumors managed by him include breast cancers, gynecological cancers, lung cancers, gastrointestinal tumors, urological tumors, head and neck tumors, and many more. Welcome, Dr. Ranga Rao, Colonel Thavle, and Rajalakshmi. You've been a cancer survivor. Tell us your experience in terms of how you dealt with it and the toll that it takes on oneself.
Okay. Okay. As of now, I am a survivor because I have sort of survived the experience. But it's still now, that is, since the time I was, diagnosed, which was in 2021. So this was 2021 May when I felt, that is when the second wave and the third wave of COVID had sort of tapered, and I felt that that there was something that sort of needed to be addressed. I mean, I had this lump. I felt this lump in my left breast, and it had grown in size, over the years. I mean, over, let's say, over COVID, rather. And in fact, there was not much scope to have it screened or shown at that at that point. So I had to wait till the number of cases of COVID sort of stabilized. And then in 2021 May, towards the end of May, is when I sort of went and saw this doctor. In fact, incidentally, my doctor, she sort of practices at Max. So she's a breast oncologist. I knew another doctor friend, and he sort of suggested that I should see an oncologist right away. Breast oncologist right away. So she was a breast surgeon also. So I went and showed it to her, and she she examined me, and then she suggested that I should straight away go and get a biopsy done. So, well, within 3 days, I mean, it was confirmed that that I had it, and it was also a rare, in fact, the rarest of cancer, of subtypes, of breast cancers, the triple negative form of breast cancer, where they say that therapies are sort of limited, and that that the only option I had was to go for aggressive chemotherapy, which would sort of reduce the size of the tumor, and subsequently I would have to go for surgery and followed by radiation. So all that took a few months. Of course, it was not easy. I mean, I wouldn't say it was easy at all. It was a new experience for me, coming to terms with so many sort of physical changes in my being. And other than that, yes, there was always this feeling, as to whether I'm going to get back to what is normal, um, and but then, of course, my family was there with me throughout. So it was a huge support. My husband was my sort of principal caregiver. He used to sit with me throughout my chemo sessions. He used to sort of monitor my diet, because there was so many diet restrictions that one had to be careful of eating, of sort of my food. And I also had to be sort of, I had to be careful of not catching an infection, because that was sort of drilled into my head, that you should ensure that you should not catch any infection. So there were a lot of do's and don'ts, but then I sort of decided that there's no point in um in 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 sort of getting bogged down by that whole experience. Uh, and I used to tell myself that things will get better, and and there will be a day when it will all come back. Of course, one had those anxieties, or whether the hair that comes back, whether it's going to be of the same form or not, or whether I'm going to suffer from any other kind of uh, uh, kind of disability, because of that, of what I'm going through. Or the constant thing was in my head, whether it's going to spread, and and for recurrence. Now, in fact, recurrence is something I keep on sort of thinking now. So it wasn't there earlier, but it often sort of comes up in my mind that I need to make the most, of my life, and that it doesn't mean that I have to be a constant, consumer in that sense of experience, but to sort of cherish the fact of people who are sort of around me, to sort of value their their presence, and to accept some things as they are. Yes, what I would have liked, in fact, what I saw in the course of my treatment was also a learning experience for me, because I saw several young people sort of getting afflicted with it, who had got who were sort of diagnosed for cancer, and it made me sad. I also saw several older people who were without any support. Their children were living abroad, and they had come on their own to get treatment. They had no assistance in that sense, and and they were just on their own. So it was quite an eye opener for me. The third aspect was the entire cost of the treatment. My husband, of course, I mean, he teaches in a university, and he's a CGHS, sort of beneficiary. So I also got, the benefit of that. But had I not had that benefit, I do realize that it would have been really difficult for even, with two incomes. We are a two-income family, and I mean, he earns quite okay. I also have, reasonably good income, but I mean, even then, I mean, I think it would have really sort of drained us of our savings. And so the thought often comes to me that, if it recurs again, yes, I would have to go through the entire process again, and it's not cheap. And it is this which constantly sort of bothers me, that there are so many people who do not reach the doors of hospitals, who do not even who would be so sort of diffident because of their economic status to seek even screening, because screening itself isn't a very cheap exercise. So the entire thing, is not really fair. I mean, I think that the government really needs to step in, Preeti, into this, in a big way. And I think currently the amount that they're spending on health is extremely sort of minimal. It's in fact very less, as a proportion of our GDP. and I think it should be far higher, because low, and middle income countries account for nearly 65%, I'm told, of the total uh, cancer burden, worldwide. And on an average cost, the cost of treatment, it I think begins here in India at around 90,000. Now, how many people, would actually be able to afford, people who have incomes like 15,000, 20,000 a month, or even less than that. I mean, it's not affordable, and I don't think that the government is doing enough on that score in terms of access, in terms of information. I don't think that the private sector, yes, the private sector can do its bit to an extent, but it's very limited to the metropolises, to the cities, and I think that a large burden actually sort of gets unaddressed, and they all come in the advanced stages. For me, with a good education, I mean that I should feel diffident of the costs involved, with the fact that the kind of toll that it takes on my family. For instance, I mean, for now, my husband has been with me, but the kind of stress that he goes through, the kind of stress that everybody goes through, so there are several issues in mind. So all these things have to be sort of thought of. Yeah.
That must have been a real challenging times. I can understand. Coming to Karila Thavle, what cancer did you have, and how did you know about it? If you can tell us something about it and your observations and experiences during the entire course of treatment.
Okay. Firstly, I had no symptoms when this whole thing was detected. I was going around with my normal walk and run, and other exercises, and eating well, and I was perfectly healthy. It's a habit from the army days that you do an annual checkup. So me and my wife, we do this every year, and frankly speaking, in retrospect, I think that is what helped us out. We got our annual checkup done in 2021, and that was in June. And there was a little jump in the creatinine level. And so we went to the nephrologist, who got a ultrasound done, and then he got a CT scan done. And because the left kidney was showing signs of reduction in size, and not properly functioning. So when we got the CT scan done, he practically jumped, because he said, "Sir, you need to go and get a biopsy done, because there's something else. It's not just the kidneys that is, So he referred me to the oncologist. Thankfully, all this was happening in the command hospital of the army in Pune, and where they have got excellent facilities for all kinds of uh, tests and reviews, and also the treatment. So when I got my biopsies done, I had to go through 2 biopsies plus a bone marrow biopsy just to rule it out. And we also got a second opinion, which is very important, uh, to get a second opinion on what kind of cancer you have, and what is the right kind of treatment protocol that needs to be followed. Especially as a patient, it gives you that much of confidence in what is going to happen hereafter. So we got the biopsies also checked by Miss Anita Borges in Mumbai, who's one of the leading oncopathologists in India, with the Tata Memorial Trust. And it was confirmed that it's a non-Hodgkin's lymphoma. Mind you, the size was uh, pretty alarming to us at that time. It was 14 centimeters by 11 centimeters by 5 centimeters or something like that. And this whole big lump was in between the two kidneys, encompassing a central aorta channel. And what actually had happened was that this lump had squeezed the renal artery going to my left kidney, and it had blocked off the blood supply. And that is why my left kidney had started failing. And as of today, my left kidney has gone. So I'm surviving with one. Uh, Now, the doctor told us, the oncologist, I must really thank him for being so positive and so helpful all throughout. He, on the first day itself, he told me, there are going to be 1,000 questions in your mind, so just keep asking. Even if you WhatsApp me the questions later on, please do, because I don't want you to go back with any kinds of doubts as to what is going to happen, what is the protocol being followed, what treatment is going to be done, and how long and this and that, and what is the outcome going to be, and so on and so forth. So it was a very nice interaction that we had with him all throughout my treatment. And he started with a protocol on chemotherapies, which was 2 days every month. And uh, by the second or third chemotherapy session, I went through 6 of them. One plus one. The initial one is the testing one. So total of 7 actually. Uh, it was 2 consecutive days every month, and the first day was bad because that was long. It was almost 7-8 hours of chemotherapy, and the second day was a slightly shorter one, but you were already exhausted from the first day. So the second day, it was quite an effort to really get up early in the morning and go there at 8 o'clock and, sort of book yourself in and all that. The good part of it was that I could eat and, have breakfast and drink tea, coffee during the chemo when the chemo was continuing. So I was that way quite okay. 15 days or so after the chemo, every month used to be pretty bad. But me and my wife and my family, both my children, we decided that we are not going to think about these kind of things. We are going to only think of how we are going to come out of this, how we are going to get well, and how we are going to face the rest of the life properly. Yes, there were lifestyle changes to be made. My wife, being a dietitian, had made a very strict protocol right from morning till evening. And I think one of the things which what ma'am mentioned about, she saw patients young and old and all. A lot of these people are not advised on the diet correctly. And I think that makes a whole lot of difference. Throughout my chemos, I never lost any weight. The type of medicines which were administered, the doctor had already told me that there was going to be no hair loss or anything of that sort. So that was the positive side of this whole thing. By the third chemo, what happened was I was more apprehensive or scared of the puncture of that, IV tube needle than going through the actual chemos. I mean, it was I had got sort of used to that chemo procedures by the third chemo. So it was quite an experience. The first 15 days after the chemo was really bad. But the next 15 days, I ensure that I sit with my laptop and I conduct classes, I run webinars, I write articles, and I kept doing that all throughout. In fact, just to inform you all that in the last year, that is into from 2021 June to 2022 April, I ran a 1 year's 2 semester postgraduate diploma course run by the Pune University single-handedly because the subject was mine and they couldn't find any other instructor for that. And therefore, I had to run that. Of course, I did it online. The second half of the month, those 15 days when I was okay, I used to run those classes. But I kept myself at it and I said, I will not let myself even for a minute think कि अब क्या होगा ये क्या हो गया है and all those, because you know initially the first 2 days was a shock. I went into this with no symptoms at all. Luckily we found it because of that regular blood test that we do, annual blood test checkups that we do, and we caught it at stage 2. So that was good. But then you can't be complacent. You can't be complacent. And one thing I learned was every person's case is different. You cannot think इसको ऐसे हो रहा है तो मेरे को भी ऐसे ही होगा. No. There were so many people around on the beds during the chemo, but every case is different. And I'm sure the doctor was going to highlight on that the type of cancers are different, the type of reactions, the type of immunity of a person, the type of resurgence by that person, back again is all going to be different. And diet and a positive mental makeup is, I think, two things, along with, of course, the treatment, is what can see you through. And that is what my message to everyone would be.
Good. I see so much of resilience and the grit to get back and the positive mindset that both my guests have spoken. I'm sure Dr. Rangarao has so many cases of similar kind. He's handled them. The reasons behind contriving cancer are really very it puts us in thought process मुझे हुआ कैसे? I mean, I'm okay, but how did I get it? Nobody knows how does a person get contrived cancer. And then what should someone do also to keep a vigil, like that's how we said, a regular medical checkup? Because otherwise, also people who don't get a regular medical checkup, how do they know that they've got cancer? They suddenly land up in the second stage or the third stage and then find them.
Actually, about cancer, there's so much to say and so much to talk about. The time is too short, but and we'll try to cover as much as possible. So first of all, I would like to congratulate both the, I would not call them cancer survivors, I would call them cancer victors, because they have gone through, I mean, survivors would be something like an earthquake or a natural calamity. Now, this is a disease which has struck and they have fought and they have won over the thing. So they are victors, something like an army victor over in a war. So it is no less than a war, and multiple battles are fought. And then I would congratulate both of them. And they have been treated in a very exemplary fashion by both very good centers. And both, I have got the personal experience both at Pune as well as in Max. I think really they've been taken care of very well. And here they have come as victors. So while I'll keep addressing your questions, and I've noted down some from Ms. Rajalakshmi's as well as Dr. Mr. Ram Table's, both of them. Can I also address them simultaneously?
Sure.
So first of all, I mean, your question was the cancer. Why is it happening? Why is it happening? So number one, let's understand one thing. Cancer is happening in a increasing incidence each year. The incidence is increasing. I mean, 20 years back, 30 years back, probably we hardly knew about cancer. We always thought that it affects Americans and the British and the Australians and not so much Indians, right? And then as a medical student, we saw cancer once in a while. And if there's a patient, so there was a beeline of all the students to go there. Today, there are beeline of cancer patients. And then all over, every hospital has it. Now, this change has happened simply because of the change in the lifestyles, industrializations, exposure to various chemicals. And let us also admit, and the science also admits that, we don't know the exact causes of cancer completely. We know only to some extent. And then though some extent where we say we know about the diet, we know about the lifestyle, I mean, like tobacco, reproductive habits and all that, we call them as lifestyle, and those lifestyle changes are brought in. But these account for about 60%, maybe 50% in together. And then rest about 30, 40, 50%, we actually do not know why the cancer has been triggered off in such patients. So that's what it is. And then all one can say is a hypothesis. One can formulate a kind of a theory that in our body, the mutations keep happening. Now, when we hear of the COVID, mutations also happen in the nucleus, the small changes in the DNA that leads to a mutation. Some mutations, they mean nothing. Some mutations mean something very important. So the mutations, when they have multiple, 2 or 3 of them, or series of mutations, they keep happening, they bring in a change. The cell multiplies rapidly, uncontrollably, it differs, it goes from one place to another place, and so on. So that is what is cancer. A normal cell doesn't go from, let's say, bone fracture is there. It will heal the bone and then stay put there. It doesn't travel to the lung. Now, that is what the cancer happens. And after the healing, the bone cancer doesn't multiply anymore. When bone cell doesn't multiply anymore, but cancer cell continues to multiply. And it is told to stop. The normal bone cell will stop, but the cancer cell would not. So it is almost like a terrorist without any control. And then it can go anywhere. I mean, it can do havoc. And that's what is the cancer. Now, these mutations, why? Important thing to realize is that mutations keep happening in all of us. And these mutations are taken care by certain systems within our body. And these systems reside in the genes and then also in certain, the immunity things. So the genes are controlling. So the mutations are discovered by the body systems. They eliminated and thrown out of the body. So before they do any damage. But in some patients, rather some people, when these systems do not do the right things, then these mutations stay back and then they cause cancer. Now, it is actually after hearing this, one feels very surprised. Oh my God, when the mutations are happening in all of us all the time, our bodies, so many millions of people, billions of people are not having cancer. That's more of a surprise. It's a surprise that only less number of people are having cancer. So that means our system is so perfect that is being able to prevent the cancers within ourselves, despite all this. But now the so-called as lifestyle factors are so overwhelming that even this immune system sometimes fails. And then these failure of the immune systems happens because of the inherited in very small percentage of people. They're born with some genes, and then some people have these changes and mutations happen, during their own lifetime. They may not be transmitted to their genes. So that's one of the things. So because of this, a person like, I mean, I'm sure Colonel Atavale has been in the army and then has perfect habits, an army person, physically fit, good diet, everything. I mean, there's no reason why he should have had this cancer, but then still there is something which has gone into it, and then maybe in his own mutation. So it's difficult to pinpoint. And then same thing with Rajalakshmi, also young, fit. I mean, everything to do. I mean, their breast cancers do have some reproductive habits, like for example, late children, and then less children, and then more exposure to hormones. Hers is a triple negative breast cancer. It's totally different. It is not a hormone induced factor. So we do not know in most of the people. I'll just also, if you permit, I will just go through certain factors which things which Rajalakshmi was saying about it. One important thing is the cost of the cancer treatment. So cancer treatment, I think she very rightly pointed out that the cost is too much. And then, I mean, it's even if you use the simplest of the treatment, the cost is probably unbearable to a normal individual. How does one do that? So I think one important thing for educated, for employed people, health insurance is a must. I think this must go on. So health insurance can cover a lot of cost. That is one thing. Fortunately, both of them have been having the cover of the government. So the government has borne the expenditure both in the army as well as the CGHS. So that's one. But those people who do not have insurance and they do not have any privilege of the panels where the government funds it, they obviously have to go to the government hospitals. And a lot of government hospitals are actually providing free services. The problem with them is that sometimes they are so overwhelmed that there may be a large waiting list, which may run into few weeks and few months at places. But then, I mean, there's no, I think now a very fact that the government has established many aims across the country, and every aims, for example, NCI Jhajjar is just few years old, but it is overwhelmed with the number of patients. Though despite lack of community, I mean, the buses and all that, they don't go. Still, hospital is full. So it just shows that the need is more. And I think the need is more. Same thing is happening with the roads and all that. So hospitals also, I think they are doing it. The next one is that there are some PM and CM relief fund, Prime Minister and Chief Minister relief fund. Once the patient himself or herself spends some money, maybe up to 2 lakhs, then they can apply through their MLA or MP to the PM and the CM relief fund. They do get help of 2 lakhs. And let me tell you, it may sound big, but this is very simple. And lot of people get this, and then it is not at all difficult. So I think you must advise these things. And then there are some NGOs which, like Indian Cancer Society, there are some, many the NGOs exist across the country. One can go through that, and that also they will also help in curable setting. They do help. And then the last one is use of the generics. We have imported molecules and we have generics. India is now the place where generics are being manufactured in bulk. And then a lot of generics are available at much, much cheaper cost, maybe 1/10 of the original cost, whatever it is. And a thing which was costing about 2 or 3 lakhs at one time is costing 3 lakh rupees, 3,000 or 4,000 rupees a month. So that's the kind of a thing, but it may not be applicable to all, and to some definitely. So these are the ways one can bring down the cost. I think they should. And I think somebody was mentioning about a second opinion. Yes, I would advise all the people to have a second opinion, so that they themselves and the family, they're all reassured they're in the right lines. And then whatever questions in mind, I think you must really write down and discuss. And then there will be some patient forums, and then the survivorship, wherever the clubs, the cancer clubs, or wherever they are there, they should be, I think, doing that. So then the other thing is about the coping up with the side effect. They were saying, how do we cope up? Yes, I think one is the most important is the mental preparation. and then preparation would require a lot of learning, a lot of understanding about the side effects, while the doctors may be busy with the people to explain to them fullest. A lot of people, like we have 2 3 things we have done in our own hospital in Paras and in other centers where I work. I've done, one is a booklet in Hindi and English, so that the people can go through them, because there are many common questions. And then that is one. Second thing is about a presentation, both in Hindi and English, a PowerPoint presentation, which can be seen by the patient, explained by the things. And then after they go through all that, a counselor is there who can explain to them the side effects, and that would, and then still something remaining, the doctor would be quite happy to address them. I mean, let me tell you, all the oncologists with their number of patients, they will not be able to do this kind of a justice of explaining. So kindly don't, I'm sure nobody's done that, but please do not blame the doctors for the lack of their time, because they have to do other important things. This is equally important, but then it can be done in several ways, and they can also learn from other patients, the nurses and all that. So I think they should know about the side effects, and the diet, the positivity of mind, and then understanding about the disease, the prognosis, and all this could be, they could really help the patient to recover faster. Let me tell you, Rajalakshmi has been very lucky that she has an early TNBC. She's on the verge of a cure. So, no two patients are alike. Right now in my hospital, there are many people who are having this TNBC, and one of the ladies is so impressive, and I'm forced to talk about her. She is young. She's just less than 40. She has the TNBC, absolutely healthy lifestyle habits. Unfortunately, she had a recurrence, and then it was stage 4, and it has gone in a very short time. It has gone to every place. And then while she's getting the treatment at home, and also, in the hospital with multiple agents, and then, if I don't want to describe the condition that she's in, because people would have tears, but she never has tears, and she's always having a smile. She's a director of 2 schools. She is in a very high position, and then she loves to go. And every time, whenever she said, the only one question after all this, with a big smile, "Doctor, I want to go back to my school and do my work." And then knowing fully well that she would have a limited lifetime in her, in the next few months or whatever. And then she says that brings her happiness, and that gives a diversion of her things. And I think I really appreciate the courage, and sometimes the cancer gives them a lot of courage to do many things, and she can be as productive. So this only tells one point, brings home one point, that diversion of mind can actually take away the suffering in many, many ways. So I think everyone, while they are doing the treatment, while they're concentrating on the recovery and everything, they must occupy their mind at home. Do not talk about it. Whatever questions you have, note them down in a diary, and then come back, and don't Google so much, because in Google, it will confuse you. The day you can repair your car with the help of the Google, that time you can become a doctor for yourself. And I'm sure nobody will venture to say, okay, my car is making the noise. What could be the reason? Let me open the engine and see. Right? I think so. Google can make you understand. I think if you use whatever the information on the net properly is fine. But sometimes it can mislead, and it can lead you to think. A lot of people say, "Doctor, I have learned so much that maybe they try to claim that I know more than you."
This was a treasure of information, doctor, and our viewers should surely benefit out of this. Now, coming back to Rajalakshmi and even Dr. Thavle, there is a lot of, other than treatment, there is a lot of psychological and emotionally that a patient is hard. So how did that affect you all? I would like to know that. I'm sure there was, you must have been disturbed by when you just came to know about it, as Rao would also agree, it really hits you. So what were all the emotional and psychological changes or thoughts and that went on in your mind,
Well, the thing is, Preeti, that I didn't break down or anything like that, but I did feel, I was a little bad and a little sorry for myself. It was a little self-indulgent, but then I felt that, that I did ask myself the question, why me? Okay. Now, till at that point, I didn't really know much, about the extent of prevalence of of breast cancer. And yes, as Dr. Rao says that, because one also has this the urge to know more about the disease itself, and and one source of information is Google. So one looks up, sort of several, medical journals. You have Mayo, you have etc. There are several, PubMed, etc., etc. So I did read up a lot, and I didn't feel really good. At the end of it, it really used to upset me a lot, because especially when I used to read about the chances of recurrence, plus the in fact the shorter number of years that I may have, as compared to any other uh, breast cancer patient. And I also, in fact, my diagnosis was between stage 3 and 4. So yes, so I'm not really sure. I mean as to what that means, concretely. My treatment, throughout my treatment period, I was okay, because I felt that this is going to sort of uh, cure me, or at least it's going to get rid of the tumor to an extent, and that I would feel better. And I did feel better. It's not that I didn't feel better, because prior to my cancer, prior to my detection, I used to have this inordinate amount of fatigue, unexplained fatigue. Like, for instance, people say that there are no symptoms, so other than the lump, I used to have this unexplained fatigue. So I used to wonder, I've not done anything, I've not exerted myself so much that I should feel so tired. I mean, even sort of getting up from a chair used to be almost like almost exhausting. So I think that was the only symptom I feel, I mean, in that sense. And the only thing I regret, of course, is that I did not get myself screened earlier, because I still have this feeling that, I don't smoke, I don't drink, I don't lead an irresponsible, in quotes, irresponsible life. And maybe I should have, now when I think. But but so then, why me? I mean, of course, and I'm also not the kinds who would eat out, so much, as compared to my husband and my son, who used to order food, quite a bit. And I used to prefer eating homemade food, and I used to come back home on time. I mean, apart from the fact that my work used to sort of take me on outstation, assignments. But again, there was nothing sort of, quote unquote, irresponsible, so which can classify as that behavior. So I did feel, I'm a little sad, I must say, but it did not overwhelm me in that sense. It did not overwhelm me, and I used to joke that at least I will know, the cause of my death. All of you, because as to say, the rest of you do not know how you're going to leave this world, but I know how. I know exactly what's going to happen, and so I used to joke about it, and we still joke about it, and I also asked my doctor once. Her name is Geeta. Okay, Kadaprat. She's a excellent person. She's a lovely person. I just asked her once, so Geeta, how long do you think I'm going to be around? She said, don't think about that, just one day at a time. Don't think about all that, huh? So, so, yes, Preeti, you've seen
Yeah.
me.
So any suggestion that you would like to give, particularly women who are suffering?
Yeah. No, I'd like to just sort of add to what Colonel Athavali said about the diet part. It's true that hospitals do not give too much information on what you should eat and what you should not eat. So we have a little it's a group, WhatsApp group of people who are seeking treatment from the hospital, that is Max Hospital. Max Vaishali is where I'm getting my treatment from. So we have a little WhatsApp group. So there we used to share tips, and I also sort of got in touch with people who had cancer, and they also sort of told me, eat this, eat that, etc. Now, these kind of tips I did not get from the hospital. So I did sort of point it out at some point that But then they have a chart. Okay, it's a standard chart. So they say this is what you to eat, this is not to eat. But then, there are things that you can do sort of beyond that also. For instance, curd, the benefits of curd. Somebody told me, just eat lots of curd. I said, okay, said, because your gut has to heal, so you have to, so that you don't get, so curd is good. It's a good probiotic. So, so that was something which I hoped that, that I could have sort of, got that information from the hospital or some other, sort of authoritative source. And yes, otherwise, like emotionally, it's been okay. I mean, I was busy in my work. I mean, I was writing throughout. I was not, I didn't allow myself to get bogged down in that sense. Yes, but as I said, and now I feel sometimes, Preeti, the thought does sort of cross my mind, about recurrence, but it's just momentary, and I think it's natural also. So if there's anything untoward that I feel in my system, I have a tendency to associate. Maybe it's that, maybe it's but I shouldn't be unscientific. I know that it should get ruled out in a test, and if it comes to that, we'll come to that. We'll go through the same process again, probably.
Would you suggest to other patients also that they need to get themselves regularly checked?
Yes.
Yeah.
Yes, Preeti, as I tell all of you also when I meet, that you should do your self-examination, sort of regularly, and screening regularly, and you should get a blood test also done sort of regularly, so that if there's anything anomalous that you notice, that then you can sort of address it early on. See, one can't prevent it. If it's going to happen, it's going to happen, because the cause is not known, how it happens. So one can't prevent it. But you can at least sort of address it early if you know the stages, and that you can live, a longer and maybe healthier life. Yeah.
Okay, and Colonel Chawle, did the presence of cancer in your body, and the related stress change actually your approach towards life, and even post cure, what is your mental?
You see, when we discovered this, for the first day, we were a little taken aback because we never thought that with my active lifestyle and all the, Josh and everything that was happening and the travel that I was doing, that, such kind of a thing would happen. But it took us about 24 to 48 hours to, get even with this issue. And we all decided that nothing doing, we have to fight this out. In fact, my doctor also, in the first day when he told us what it is and what. So one of the things which he told us was also, okay, what is the percentage chance? I asked him actually. I said, what is the survivability rate for this kind of a cancer? So he says it is between 70 to 80%. It depends, varies, depend what stage and things like that and all. So I said, okay, so I am in the 70 to 80%, which has to be survived. So, that kind of a mindset is what we started off with. And of course, I used to joke with people, like I am a CBRN expert, a chemical, biological, radiological, and nuclear expert. So there was an external bio which had come inside me. There were chemicals which were pumped inside me. There was radiation which were pumped inside me. So I was not only by mind, but also by body, I became a CBRN man. So so that is how I used to take this kind of a thing. And I think I never thought that something bad is going to happen to me. I always thought, yes, this is just a phase and I'm going to come out of it. So that is one. The diet needs to be told to people, that especially people from the low strata, illiterate people who have not been informed, who have not been able to read. Ma'am mentioned about Googling about her disease and finding out or reading up much more on that. Very few people do. I think mental resilience, good diet, and following the protocol, what your doctor has said strictly. You must listen to your doctor. That is very, very important. Of course, take second opinion, take third opinion. That is not a problem, but you must do that. But once it is set, then must listen to what the doctor is saying. In fact, even if I have to take a paracetamol, I text him on my WhatsApp and I ask him, this is what is happening. Can I take a paracetamol? He said, no, instead of paracetamol, you take Ultrasec. I said, okay. But that is the kind of thing which I'm following. He had told me that do not take any medicines without asking me.
You've got to be very careful.
Very careful, yeah.
Okay. Last word to Dr. Rao. Doctor, the screening facilities are not many in our country, and people don't even know about them. The awareness level is too low. And are there any measures that are being taken to spread this information and how to get diagnosed or even get treated for that matter? And what is the medical community actually doing about it? Government being another stakeholder in investing in healthcare is totally another issue. How will you explain that?
Okay, fine. So let me start with the awareness problem, and then the next is the screening and checkups. So, for example, we recently went through the whole pandemic of the COVID in our country. We lost around official figures, quote about 5 lakh patients we lost, their lives were lost. And the numbers are about 40, 50 lakh patients had the COVID infections. Even if you believe these figures are right, if you just compare them with the what do you call the cancer figures, every year we're losing almost 10 lakh patients to cancer. Now, where is 5 lakh patients over 2 years who lost their lives? And where is 10 lakh patients each year? And the number is increasing by each year. So imagine that, in so many years we've been losing patients. And then at the same time, the number affected is about 17 to 18, maybe it will be touching 20 lakhs very soon every year. New patients. And if you count all the old and the new, the numbers would come anything between 30 and 50 lakh patients. So the magnitude of the cancer is so huge. And tell me how many you can count, how many COVID discussions you had on each TV channel, and how many cancer discussions we had, a problem which is troubling. And these are two lucky people, but there are many unlucky people who can't afford treatment, whose the whole, not only the lives of the individuals, but the whole lives of the families have been ruined completely because of the cancer victims. They're really the victims, worse than the earthquake victims. They've been shaken up by this cancer earthquake. So the awareness is totally lacking. I think the most important thing the mass media has to do is cancer awareness. And I wish every day there is some discussion in some channel or the other about the cancer that would really bring about the awareness of the cancer. That is, I think, one important thing. Second thing is, even the Colonel Ram also showed up this question in the meeting chat. And how do we check up? Let's talk about the normal persons. And then the thing, normal persons, it is generally the responsibility of the government for the entire population. With our huge population in this country, with even no country could actually make a screening program viable for this. Impossible. With the kind of population that we have, and then the parity of the health facility, if we can treat them, that will be good to think of the screening. Nevertheless, their National Cancer Registry program, and then the government of India is making a lot of efforts to diagnose early cancer, the common cancers in the early stages. There are a lot of things are happening at patchy in different places where they are needed. They're not available to the entire public. At the same time, some NGOs, some hospitals are also running. But meanwhile, it's not the responsibility of the government alone. What can the government do if somebody chooses to smoke tobacco? He will smoke the whole tobacco and get a lung cancer, and then he can't blame the government for that. So consumption of tobacco in all forms is by individual choice. I think that awareness, if it comes in, it'll be quite nice. They're hiking up the taxes. No country except few have banned the tobacco. So I think that's also applicable. But in India, I think government has really taken a lot of steps to curb the tobacco, like public smoking and all that. Multiple things they have done. Something they could have done and not done. But I think we must appreciate what has been done rather than cribbing about what has not been done. And it is the public, if they are aware, at the school level, the college level, tobacco will be going off.
Allow me to interject, doctor. Yes. We've come across but many cases of smoking and tobacco eating people also who just do not have anything like this, even till the age of they're surviving till 90. And
yes,
to see that they consume a lot of tobacco, smoke.
Exactly. So we have, we were talking about the genes in us. So we have the tumor promoter genes suppressor genes. Now, this is something which we must understand. They are called as a cancer suppressor genes and cancer promoting genes. Cancer promoting genes are promoted by tobacco or some bad diet. The tumor suppressor genes are inherent in us. They are there all the time. They are the ones who detect the mutations, eliminate the mutations. So a person who's smoking has got very strong tumor suppressor genes. All the mutations are eliminated in him, and he doesn't have this, cancer. And he can say smoking doesn't cause cancer. Right? A person who has just inhaled his boss's smoke and doesn't smoke, right? And then he would be not having sufficient tumor suppressor genes in him. He will land up with cancer. He says, I've never smoked and I have cancer, but his smoking is as a result of the passive smoking from his boss. So, I mean, this is what exactly explains the whole thing. We need to unravel the genetic mystery which is underlying in our body. Let's also understand that when we are born or conceived, everything what is to happen in us is already programmed in those one single cell. We are nothing but the programmed biological products. And then everything, what is going to be my height, what is going to be my color, what is going to be my intelligence, what is going to be my everything is already programmed in that. Programmed, and then what diseases will have. So we are like that, and then something keeps on adding in the lifestyle, and that's a mystery. I think there's a long way to understand that. Now, coming back to the awareness, I think the responsibility of the mass media is to bring about the awareness, and of course the government, private, all the agencies will do that. And then for the normal people, they should, for healthy people, I mean those who are conscious, they could get themselves annual checkup, like in the army it happens. And then same way for every serving soldier, same way they could have a checkup, like their car goes for servicing. At the periodic interval, they'll get a call from their service station, and they will also remember my car is fine, because it's very important for them. Similarly, our health is an important thing, and then let's also have annual checkups with their self-examination, and then self-examination is one important thing, and the cancer checkups wherever possible, or rather I would say annual health checkups, including cancer checkups. For every lady, a gynecological examination once in 2 years is a must. And then they should do the breast self-examination from the age of 25, all the ladies, because breast cancer is on the rise. And then the rest of the examination, like an X-ray or a CT scan of the chest in heavy smokers, ultrasound of the abdomen in some highly susceptible individuals, those are the ones which can be helping. And then the people who have elderly, they could have the PSA examination for the prostate. So there are some cancer checkup programs which are available all over. They could do that. So that is one. And then by knowing the symptoms of cancer, by having the health checkups and all that, one can diagnose the cancer much earlier than the advanced stages which happens in our country. So I think that way, not only we bring down the cost, but also increase the cure rates of this. So awareness saves lives. I think that's one of the important messages which I want to give. It has happened in every vaccination that we're doing, whether it's a polio, measles, and all that. Awareness, and then have the vaccination. Look at the smallpox eradication that's happened. It could happen only because of polio eradication that's happened, simply because of the vaccinations and the awareness. If vaccination was there, if the awareness is not there, how can it happen? What happened in the HIV? Awareness has helped to save a lot of lives. What happened in the COVID? Though a lot of people did not have vaccination, majority had vaccinations, but then they prevented they completely prevented the whole pandemic happening now. And that is because of the awareness. So awareness can prevent, say, the cancer, or rather it can detect the early cancers. It can save a lot of lives. And awareness program must happen through all panel kind of things, whatever it's possible. I want to emphasize about the diet, which has been talked about. What is the science? What does the science say about the diet for cancer patients while on treatment? For a patient who is able to eat normally, I think they should have balanced, healthy, and hygienic diet. If they don't have any medical problems, there is no restriction of sugar or anything, but the diet can be customized according to the medical problem that they have, like Dr. Ram, Colonel Ram had said about the kidney. So whether it's a kidney, whether it's a heart or diabetes or whatever, and then that should be taken care of. Otherwise, there is no omission or inclusion of any dietary things. One could have a balanced diet, but a good amount of proteins, not extra protein may not be required for all, except when the albumin or something is very low. So that is one. We should not be victim of the myths that do not have milk, do not have sugar, because they promote sugar. That's actually, they have no meaning in that. If milk was causing the cancer, then every human being, every living being in this, every mammal in this world should have had cancer. It doesn't happen. The milk is broken down to whatever proteins and carbohydrates in our body, and it doesn't go milk into the blood and cause cancer. I mean, it's absolutely, it's not right. If too much of milk is consumed, it may add to the calories. Yes. So excess of meat, excess of, the dietary products are not recommended, but standard normal quantities of milk are quite fine. And curd has also been mentioned. It's a very healthy diet. Curd, buttermilk, I think in the right proportion, that will be fine. But the whole diet cannot be replaced by curd, right? Then the next thing is the sugar. Sugar is a myth that consumption of sugar leads to cancer, and cancer patients should not eat sugar because sugar is taken up by the cancer cells and they try. Let us understand one thing: whether I eat an egg, whether I eat a chapati, whether I eat dal, ultimate product of these dietary things in my body, and so also in everyone's body, is they are converted into the basic ingredients of the protein and the carbohydrate, sugar. It is ultimately converted into the sugar they consume. Then that sugar is given as an energy to my brain, my heart, my muscles, my everything. And then whether you consume direct sugar or any other dietary product. So saying that sugar will promote the cancer cells to grow, I think that's not at all founded. But too much of sugar, too much of sweet in the diet for normal people and cancer patients, when it's not recommended in right proportion, they're quite fine. So there are no reason to include or conclude the diet. And then every doctor will say you can eat everything, hygienic, most important thing, so the infections are not there. Those people who are having some problems like low counts, which happens in the leukemia, they should take away the raw products of the diet in their diet. Those people who have ulcers in the mouth may have to have softer diet. Those people who cannot swallow, they may have to have liquid diet. The people who cannot swallow anything at all, they're given a tube feeding, either the Ryle's tube or something. So these are the special things which are required for the patients. So therefore, dietary, so whatever the doctors say is fine. I mean, it will be individual. The diet will be individualized to the patient. So I think the best way to is discuss with your own nurse, and then nurses are also, a lot of nurses, oncology nurses, are well informed. The dietitians sometimes are also well informed, so we could discuss with them. I think Dr. Colonel Ram had the advantage of having his wife as a, the things. So the other thing is, while the treatment is going on, the hand yourself over. Like a child in the parents' hands or the father's hand, he would not question his father, will I fall down if you don't hold me properly? He would not even think. He will just say, he'll be laughing aloud even if he's thrown up into the air. I mean, that's the kind of a confidence that he will have that much of confidence in yourself, in your team, in your family. I think that's important. Then meditation, yoga, and all that, I think they really help you a lot. And then having questions is very healthy thing. Have your questions. Coming to the prognosis, some people say, how long am I going to live? There is a lot of difference in the Indian mindset and the Western mindset. Let me tell you, this is by pure experience. I have been to many Western centers in all over the places, the best of them. And then wherever you go, even the BMT room, I have witnessed the conversation between the doctor and the doctor. Do you think I'm going to live till tomorrow morning? When he's having acute complications. The doctor says 50-50. Let me ask you this question. How many of us can digest this if I tell as a doctor to my patient, by tomorrow morning, you may not be alive or alive? I'm not sure. If they have an acute complication, will we accept it? अरे कैसे डॉक्टर है भाई, ये तो बोल रहा है मैं मर सकता हूँ, फिर ये क्या डॉक्टरी कर रहा है? This kind of a thing is there in that. So mindsets are different. Or I mean, it's very impossible for me also to discuss with every patient. I have witnessed a patient, a naval officer's father, when I was in Ashwini in Bombay. And then that father came from a village background and he was having a terminal cancer. And the son said, sir, how do I tell him that? I said, okay, let me try. I went and sat down with him alone and just held his hands. How are you feeling, sir? And then very elderly, very learned, very wise man, not educated from a regular standard, not a graduate, but a village person, extremely wise, extremely learned, I would call him, without any degrees, but very, very understanding. I just held his hand. How much you want to know about your disease? Full or half? You want me to tell you, give you a painted picture or the real truth? He just thought it over, and the next minute he says, please tell me the real truth. I said, what if the real truth hurts your mind? And then he said, doesn't matter, I will handle it. And then I told him this, that, okay, I mean, you are having a problem which is not going to be cured or not going to be controlled. I unfortunately do not have any means to control your things except the pain. And then he said, how much time do you have? I mean, do I have? And I told him very clearly, it could be just few days or weeks. He just kept quiet for a minute. And then that is the time he said, Doctor Saab, आपने हमारा भ्रम दूर कर दिया है. In this Shuddh Hindi, he said, मेरा भ्रम दूर कर दिया है. And then after that he said कि मेरा भ्रम दूर हो गया, अभी मुझे स्पष्ट दिखाई दे रहा है मुझे क्या करना है. मैं अपने बेटे को बुला के बोलता हूँ, मुझे इस जिंदगी में और क्या क्या करना है. मुझे घर जाना है, मेरे लोगों से बात करना है, मुझे मेरे कुछ काम है, घर के हैं कुछ काम, ये सब करने हैं. Now, these are the things which he had a clear-cut agenda ahead of him. Now, these kind of people are very few. And then the boldness in the doctors, I would say, is lacking. And then the boldness among the relative. Most of the people will enter my room. Doctor साहब, मेरे father को मत बताइए कैंसर है. हम बता रहे हैं उनको कोई infection है, कुछ बीमारी है, वो ठीक हो जाएगी. Stage 4 cancer we're talking about. So I think our Indian mindset is we don't accept the death as a natural thing in our body. I mean, we think that the death means is a mistake. Nobody should die. And definitely if something is happening, I mean, like death in the hospital, it's a hospital or the doctor's fault. So I think we have not come to, so probably we will grow a little more in this kind of a thing. Though our olden days, I think a lot of people have understood the death. Even the king, when he was dying, he used to get all the people around him and talk to them. Let us see that we used to have that. You know, I mean, in the Sanskrit and in various shlokas, it's all mentioned that in the end times, the kings and all the people used to sit down. We have heard Bhishma talking to everyone, and when he's dying. So we have all such situations out with mythology says about the death. But today in the modern world, we have not accepted the death. So I think that's about the thing. So the prognostic part of it, I think should be fine. So I think I've said about everything. Any questions? So I think Colonel Ram asked about how do we prevent or detect recurrence? I mean, honest answer is that we don't know how to prevent the recurrence apart from the adequate and the proper treatment that you're going to have. And then how do we detect the recurrence? By regular examinations, even after the treatment. Any symptom, the symptoms would vary according to the patient, the stage, and the cancer. So I think whatever symptoms, abnormalities you find, please report to the doctor, and then have the checkups. And then those kind of things we can, if a recurrence has to happen, the recurrence will be detected early, and then there could be always a chance that we could give to the treating doctor that okay, whatever chances are there, we can take them on. And then my advice to all the people, to wherever they are, understand the prognosis. We have not come here to stay forever. If we have not come to stay forever, all of us will end with something or the other, an accident or a heart attack or a cancer or anything. So it's just one way of dying. So accept the death as anything, and then be bold. I mean, we can go on talking, we can go on saying about this, but I feel that, as after having seen many people like this, a lot of people have taken that the son is saying, sir, don't tell about the cancer. The father walks in, Doctor साहब, मुझे सब पता है, मुझे कैंसर है, मेरे पास बहुत कम समय है, ये बच्चे ऐसे ही करते हैं. So what I see there is fear of the children, and then rather than fear of the patient. And then when these barriers are broken, let me tell you one thing, a communication between them, the father and the son, is much better. If you ask a dying person, what do you want to do? A dying person, I'm not saying on deathbed, but let's say he's got few months, or whatever the science says, few months. Then if he knows what is to be done, he would do that. There are many people who've done, they say, Doctor साहब, कितना समय है? कम समय है, ज़्यादा है. I can't pinpoint, but आपके पास में ज़्यादा समय नहीं. कुछ treatment है? नहीं है. मैं घर जाऊंगा डॉक्टर साहब. मेरे पास बहुत सारे, मेरी बेटी की शादी करने, मेरे बेटी के लिए ये करना है, मेरे को विल बनाना है, घर का करना है, प्लीज अलाउ हिम टू डू दैट. आई थिंक दैट्स द वे I tackle with my patients a lot. Some people, yes, every patient I cannot do that, but a lot of people I make them understand, the family understand. Some of the friends also can take over. So that's about the things, right?
I would now sum it up as, awareness, normal dietary habit, normal healthy dietary diets, then regular health check, and positivity of mind. I think in that state are the key takeaways from this discussion. I hope the session has been helpful, not just for cancer patients but for general public also. Thank you, Dr. Rao, Rajalakshmi, and Kanla Chawle for being here, and the valuable insights that each one of you all have given us. Thank you once again. For my audience, I'll be back again with another episode soon. Till then, signing. Namaskar and thank you.